Weekdays, 9 a.m. from Fox 35. This is Good Day Orlando.
How about this story? You brush, you floss like you're supposed to, but does it ever seem like every time you visit the dentist you have another cavity? Well, it could be your workout that's to blame. A recent study looked at triathletes. Researchers found that they have significantly higher levels of tooth erosion than non-athletes. They also found that those who trained more often had more cavities than athletes who trained less. Okay, you work out, you get more cavities. What's the story here? Joining us now is Dr. Brett Zach. Always good to see you, man. Appreciate you coming in here.
Thanks for having me back.
Okay, when you explained a little bit about this, it makes a little more sense. So let's talk about what this study found. So triathletes in particular, why did they have more cavities, you think?
You know, the story is working out in general. To me, people who work out, that's a great thing. Keep working out, keep healthy, keep your weight down, keep your diabetes away. That corresponds with periodontal disease. Triathletes in particular, they can have a higher incident of decay. The sport gels, the energy bars, the energy drinks, those items are laden with high contents of sugar.
So again, you're talking triathletes who train for 3, 4, 5, 6 hours a day.
Correct.
They're pounding down tons of carbs and sugar. Is that what they found in this?
Absolutely. So you take in all that sugar, you're not drinking nearly as much water as you should, and on top of that, I'm sure, as you know, when you work out, when you jog, when you run, you're breathing heavily, okay? Breathing heavily tends to dry the mouth out. When you dry the mouth out, your saliva goes away. Your saliva is the body's natural rinse, okay? So you're introducing the sugars, you're taking away the saliva. The combination of those two things can cause decay.
Were the numbers outside of the norm, though? I mean, really outside the number where people have to be conscious and say, if I'm working out, I'm going to have to drink more water, otherwise I'm going to be in dentures soon?
No, it's a great question. It's an interesting topic. I don't think the numbers are exponential here. I think it's just something to keep an eye on. I think we're talking to a more segmented market here. People, like I said, those people who are training several hours a day or several times a week. And there are things you can do to combat that as well. It's not, if you're a triathlete, if you drink these energy drinks, you're going to get the decay. That's not how it works.
One other thing I thought, when I first saw the headline, one thing that popped into my mind is when you're lifting weights, you're grinding all the time.
Sure.
My dentist always warns me about that. I don't even realize I do it, but that's a bigger problem than people realize, I guess.
That, to me, is actually a bigger issue than the decay issue. The grinding, the pressure you can place on your teeth from lifting weights, and even grinding when you're sleeping, can become a huge issue with tooth erosion, tooth abrasion. That combined also with the sugars, the acids from the sugars. Okay, the combination of those two things can be pretty damaging to the teeth.
But let's be honest, if you wear a mouth guard into the gym, you're going to get laughed at. So I don't know, nobody's going to do that. Well, some people might do that.
I don't do it.
Right. So what would you do? I mean, just kind of be conscious of it?
Be careful, be conscious of it. Yeah, I mean, like I said, working out's a great thing for the overall body health. I'm not going to say not to do it. Keep what you're doing. Just keep in the back of your mind, especially with those energy gels, energy bars, energy drinks. Chew extra gum, sugar-free gum. That'll help saliva. Drink water and see the dentist.
Get your rinse. Yeah, you wear a mouth guard to the gym, somebody may want to box.
Yeah.
So be careful out there.
I wouldn't do it.
Then you will see him. Dr. Brett Zach, always good to see you, man. Appreciate it. What's your website in case people want to check you out?
Sure, it's NLCZ Dentistry.com.
All right. Thanks so much. Good to see you.
Thank you.
All right, 9:14.